Hi, I'm Catherine Revis, and this is a recording for discussion week 2 for pharmacology. This is why counselors should be screening for bipolar when speaking with a depressed client. So mental health counselors should be screening for bipolar disorder and a depressed client because just diagnosing a client with depression, if a client truly has bipolar disorder, can be harmful to the client. A study done in 2012 by Bipolar UK, the Royal College of Physicians, Bipolar Scotland found people with bipolar disorder wait for an average of 12.2 years before they are diagnosed, and often spend years receiving treatment for other conditions. Receiving the wrong diagnosis and receiving inappropriate treatment can cause the symptoms to become worse, making the client feel worse, which could lead to more drastic repercussions such as client losing hope and finding a solution, or even worse, giving up. According to Bipolar UK, in the same article, it states a delay of this length has a significant impact for individual and families with sometimes devastating consequences, as bipolar has the highest rate of suicide and of any psychiatric illness. So one can see that, the most important part of helping diagnose a client correctly is the right information. What that means is sometimes the client withholds important clues that may help a mental health counselor get a clear picture of what's going on with the client to help with the correct diagnosis. It's important to screen for as much information as possible when a clinician is with the client. If a mental health counselor is unsure of a diagnosis, it is best to wait and consult with a prescribing physician or see the client several times before making a diagnosis. Because a diagnosis directs the course of treatment, it's important for the client and the client's time to work towards a correct diagnosis. Just looking at depression without making sure there are not any underlying disorders that can be detrimental to the client. According to Psychology Today, bipolar disorder in its early stages can look a lot like major depressive disorder, and antidepressants can spur manic episodes and do little to treat the condition. Psychology Today also states that careful diagnosis tactics can help prevent misdiagnosis. So Psychology Today also talks a little bit about how you can do a thorough test like a diagnostic test to make sure that everything is covered. So I'm going to go through a list of that right now. The first thing is does the clinician accept everything the client says, or does he or she ask probing or follow-up questions? Does the treatment provider ask for information from close family members or a spouse? So a mental health professional can only do that with the client's permission, but an accurate diagnosis is better with all the information possible, and getting an outside observer's perspective can definitely help. Another thing is does the clinician take their time, or do they rush through appointments? Does the clinician explain what tools he or she will be using to diagnose? Does the treatment provider seem interested in getting feedback from the client? Does the clinician ask about the client's lifestyle? The clinician should be screening for environmental hazards, relationship challenges, substance abuse, and similar issues that can undermine the client's mental health. Does the client feel comfortable sharing opinions? Meaning, does the clinician provide a safe space for sharing? Does the clinician adjust their own perceptions based on information the client is giving, or does the clinician push their own worldviews or how they view a situation? Does the clinician seem to be open to every client's ideas, or does the clinician harbor stereotypes? Does the treatment provider collaborate with other treatment providers? Will the clinician get a full history of the mental and physical health of the client? Also, does the clinician ask about specific symptoms? So being thorough with the client and getting a solid understanding and picture of what they are going through is very important for accurate diagnosis. So I'd like to talk a little bit about signs and symptoms a counselor should look for when diagnosing bipolar disorder. First off, manic episodes or episode, hypomanic episode or major depressive episode. According to the DSM-5, this would include a distinct period of abnormally and persistently elevated expansive or irritable mood and abnormally and persistent increased goal-directed activity or energy, lasting at least 1 week and be present most of the day, nearly every day. The episode is not severe enough and to cause marked impairment in social or occupational functioning or to necessitate hospitalization. Also, if there are psychotic features, the episode is by definition manic. Depressed mood most of the day, nearly every day, as indicated by either subjective report, so does the client feel sad, empty, or hopeless, or observation made by others, so do they appear tearful. Medication, so benefits and side effects for bipolar disorder medication. So mood stabilization medications are where most prescribing physicians start, and there are a few to choose from. Some include carbazepine, carbatrol, Divleprex, which is a sodium, and then lithium. So how does one know what is best for them? That will be up to the prescribing physician and will be based on the information given during diagnosis. Some medicines just treat depression or mania. So a client may just take one or more than one medication for bipolar disorder. Sometimes the clinician and prescribing physician can get the medication correct the first time for the client and no adjustments will be needed. But according to WebMD, a client may need to try several different kinds of medications and different doses to figure out the right approach. And that can take time, and it also can be frustrating. So word to the wise is don't give up. Eventually, you or your doctor should be able to find a prescription that works best for you. It's important to understand that taking medication and taking the medication correctly should be a part of daily routine. So missing medication can be detrimental to the success of the treatment. And if it's not working, the prescribing physician or the clinician won't be able to tell because you're not being persistent and consistent with it. Some of the benefits include a more level mood and better brain function, less anxiety and depression, and increased energy and confidence to conquer each day. Some side effects that can come along with mood stabilizing medications can be nausea, tremors, hair loss, weight gain, liver damage, and diarrhea. Always consult with a physician if any side effects are persistent. And remember, sticking to the treatment will create an accurate picture of how well the medication is working.